not giving you a chance to drop her back.
If she's still, she's twitchy.
How much did she weigh?
26.8.
That'd be here.
What's your size again?
You're taking her in for X-ray to see if there's any reason why she's having so much difficulty breathing. Did you see anything in her lungs?
Her. "45 minutes after we stayed, we reversal. Main reason is so the ketamine kind of wears off, so they don't have a rough recovery.
Look at you.
Didn't do it. Well, I hear increased noise, but no, maybe some, like maybe a small wheeze with on exhale, but she's breathing so heavy that I can't say it's like a wheeze. It might be just so much effort. So today we sedated Sassy Caracal. Last couple weeks she kind of had an elevated respiratory rate, but when we snuck up on her and she was sleeping, it wasn't that elevated. And then yesterday, someone caught a video of her sleeping, and it was a little bit increased. So we made the decision to sedate her. On X-ray, you can kind of see. It's very difficult to see the silhouette of the heart. This is possible lung lobes. So it's difficult to know for sure, but there's a possibility of being some fluid there, either in or around the lungs. On the VD, it's also kind of hazy here. The main thing I wanted to do is listen to her and see if I could hear any abnormalities. And today, when I listened to her, I was not able to hear any crackles. I wasn't able to hear any decrease in sounds of the heart or lungs anywhere. So if there was fluid somewhere here, usually it's harder to hear the lungs or harder to hear the heart when you're going through fluid. And there was no sign of that. So at this point, we're kind of at a loss on where to go from here because there isn't any obvious sign, no coughing, nothing like that, just a mild increased respiratory rate. There's definitely something going on with the lungs, and right now I think we're going to start with giving her some antibiotics just in case there's any kind of infection, as well as a low dose of a steroid in case there's any kind of asthma type symptoms or any anti-inflammatory effects that could benefit her at this point. If she's not improving with that treatment, the next option is probably going to be an ultrasound to evaluate her heart and to make sure there's no obvious heart disease. So at this point, it's kind of wait and see how she responds to the medication.
Well, thank you very much.
You're welcome.
It's a better prognosis than I expected for a 21-year-old Caracal today.
Yeah. And so I guess the semi-good news, I don't see any obvious signs of cancer or things like that. And she's eating good, even though we recommended a diet because she has really bad arthritis in her elbows and shoulders. She's gained 3 pounds in the last 3 months. And so we definitely need to get her weight under control and kind of have her lose some weight. So that's the good sign is she's not acting sick.